Hi everyone, my name is Destiny Gui and I'm an MD candidate for the class of 2021 here at the Carver College of Medicine.
Hi, I'm Dr. David Moser, Professor of Psychiatry and Director of Educational Outreach in the Office of Diversity, Equity, and Inclusion here at the Carver College of Medicine. Today's presentation is brought to you by our Office of Diversity, Equity, and Inclusion, and there will be a slide at the end of the presentation so that you know how to get a hold of us if you'd like to. Destiny and I very much wish we were talking with you all in person today, but given the current COVID-19 pandemic, we are practicing responsible social distancing, and we are coming to you this way instead, but we hope it will be an enjoyable and useful learning experience for you. Knowing how to intervene effectively when you see someone mistreated is always an important skill. And it is particularly important during times of increased stress, like our current circumstances, when for many of us our practical and emotional resources are wearing thin. And additionally, and unfortunately, the pandemic has brought about increased discrimination and racism toward our Asian and Asian American community members. And many of these folks are facing misplaced blame for the current pandemic. And we want to talk a little bit in today's presentation about how to be supportive of our Asian and Asian American community members and all of our colleagues and friends.
The goals of this video today are to help us become more aware of the concept and impact of silent collusion and be able to recognize microaggressions and more overt forms of offensive behavior. We're going to discuss strategies for effective intervention when you observe the mistreatment of others or if you yourself are the victim of mistreatment. Too often when we do observe mistreatment, we stay silent and we don't think about what we could have said or done until after we go home and it's too late. So today we're going to talk about tools you can use in order to do something.
Some of the concepts and terms we'll be discussing today include silent collusion, what it means to be a bystander, what it means to be an upstander, and we'll talk a little bit about microaggression and more overt forms of mistreatment as well. Silent collusion is what happens when we see someone being mistreated in one way or another and we just keep silent. Sometimes we feel like we will just stay out of it, or the best thing to do is stay neutral. But in fact, a lot of the time, if we do stay neutral or if we stay out of it, we're actually providing tacit or unspoken approval to the person that's doing the mistreatment. And we're giving the message to the person who's being mistreated that we don't even see it or that it's okay in some way. And that's what we refer to when we use the term silent collusion. By bystander, we simply mean someone who's present when mistreatment occurs.
Becoming an upstander means being a person who takes action. It can happen in a number of ways. You can use a situation as a teachable moment for the person who committed the offensive behavior. Or you can use the situation to provide support to the person who has been mistreated. Another term we're going to discuss is microaggression. This can be a statement, action, or incident regarded as an instance of indirect, subtle, or unintentional discrimination against members of a marginalized group such as racial or ethnic minorities. But it's not limited just to racial or ethnic minorities. A common misconception about microaggressions is that they're just little things that hurt people's feelings or that people are just being too sensitive. But the impact of microaggressions is not just about having your feelings hurt. In the words of Dr. Robert Montenegro at the Seattle Children's Hospital, it's about how being repeatedly dismissed and alienated and insulted and invalidated reinforces differences in power and privilege and how this perpetuates racism and discrimination. Imagine that someone may experience these types of microaggressions on a daily basis. This can become really exhausting and change the way that a person views and interacts with the world. Some examples of microaggressions for those who are less familiar include the following. When a white woman clutches her purse when walking past a Black man, this is signaling that she thinks that Black men are dangerous criminals. When you ask somebody who isn't white, where are you really from? This signals that this person is not American and you don't see them that way. Complimenting a gay person by saying, but you're not gay, signals that stereotypically gay traits are negative. And finally, in the hospital setting, we may see that a male physician is introduced as Dr. So-and-so, but a female physician is introduced by her first name.
I think those are excellent examples. And sometimes Destiny, I find that people feel like the very term microaggression, just the use of the prefix micro there does imply that it's not a big deal or that it's something small. But these things actually do have a huge impact on folks, and I think it's great that you pointed that out. So now we're going to explore these concepts by going through a few cases and vignettes. All of the scenarios that we're about to present are based on real life events that happened. We have fictionalized them slightly just to protect the identities of the folks involved, but these are not made up things. These are things that have happened and things that happen all too frequently. And in each scenario that we present, we would like you to ask yourself some questions. So ask yourself, what's going on here? And how would I feel if this were happening to me? And if I were present as a bystander, what might I be able to do to become an upstander, to take some action and be supportive of the person who's being mistreated?
All right, so our first scenario, an African-American woman who previously had short hair comes into the office with long braids. She receives compliments on her new hairstyle, but also receives intrusive questions about how it grew so fast and is it really hers? That afternoon, a senior male colleague reaches out and touches it. He also says in a joking tone, "Does this make you feel uncomfortable?" Shocked, she says no, but she's visibly upset.
Sometimes when we give this talk, an audience member will speak up and say, "Hey, what's the big deal about noticing a change in someone's hairstyle or even giving them a compliment?" And, obviously our point here isn't that that's problematic, to give somebody a compliment. But in this scenario, some of the questions and comments were more intrusive than that. They were rather sarcastic. Someone saying, "Hey, is that hair really yours?" Or "How'd it grow that fast?" From people that are intentionally kind of asking that in a sarcastic manner. Hopefully it's obvious to most people that that reaching out and touching someone like happened in this scenario is unacceptable. It might be surprising that this actually happens more than you'd think. And one scenario that some of you might be able to relate to, if you've ever been pregnant, is it's not unusual for when women are pregnant for people around them to suddenly kind of lose a good sense of their boundaries and feel like they can reach out and touch a pregnant person's belly. And even though that might be entirely unwelcome by the person being touched. So that's a similar kind of scenario that we see where sometimes these physical boundaries are broken down in an inappropriate manner. Destiny, what are your thoughts on how a bystander in this scenario might be able to become an upstander and be supportive of this person?
Thanks for asking. I've actually spent a lot of time thinking about this particular case, and in preparation for this video, I spoke to several friends about this issue. Just like you said, this is a way more common issue than people might think. Almost all of my Black friends have experienced something like this. Another point that my friend brought up to me was that to Black women, their hair is much more than just hair. There's a lot of cultural significance behind their hair. In one story that she shared with me, a dermatology resident actually lost professionalism points for wearing her hair naturally. So I asked my friend what she might think about as far as a bystander speaking up during the situation. And she actually said that unless the person were obviously in physical harm, that maybe in the moment, the bystander would keep quiet and then follow up later on and ask the person who was mistreated how they were feeling, maybe offer to support them if they were wanting to report the incident in any way.
Okay, yeah, thank you. So I'm going to share another scenario. And Destiny, this one is an experience that was shared by a female medical resident. And I'm going to read it just to make sure that I get her words right. But so she said, "My parents are both from Pakistan, and I was born in California while they were in med school at UCLA. I'm a second-year resident now, and the other day a male attending physician and I were being introduced to a patient. And the patient took one look at me and said, 'Where the hell are you from?' And before I even had a chance to think or respond, the attending physician said, No worries, she's from here. She went to a good school too. And that was that. Like, we never discussed it further. So how do you think that that made me feel?
So some people in the audience might think that it's a perfectly innocent question to ask where somebody's from. Um, in this case, the tone and words used make it obvious that the person was not asking just out of curiosity. But in other situations that I've personally experienced, even when somebody's just asking where are you from or where are you really from, the implication is still that they don't believe that I'm American or that I belong here. It's especially obvious when you enter a room with a group of people and the only person who is asked is a person of color. Also, they never seem to be satisfied when I tell them that I grew up in Iowa City. The attending physician in this case was likely trying to help and coming from a place of good intent, but some of his word choices might have ended up validating the patient's concern. For example, the way that the physician said, "Oh, don't worry, she's from here," means that the patient's concern about where the resident physician is from was a valid concern to have. Additionally, the physician implied that it's noteworthy that the resident went to a good school, as if this might be not expected.
Yeah, definitely. Those are important points in this scenario. And when we've workshopped this with some audiences and talked with people about how these things might be handled differently, a lot of people point out that even though he was coming from a place of good intent, probably, the physician could have just waited a moment to see if the resident wanted to respond herself, because she might have handled the situation completely deftly, just done a nice job with it, defused the situation, and moved along. But she never really got that chance. And even if she didn't, it's possible that the attending physician could have said something like, "Hey, we have residents from all over the country and around the world here at UIHC, and we're lucky to have that diversity. And we understand that some of the folks that come here are curious about where we're all from, but we're going to need you to keep the tone more respectful than that if we're going to be able to work together as a good team on your healthcare." And usually, that sort of team approach, brings people kind of back in, and it's a firm but somewhat gentle way to say, hey, we're going to need to be kinder and more respectful here. Another thing that the physician could have done is maybe ignored it. And if the resident ignored it and the physician ignored it, it could be arguable depending on the specific scenario whether that's the right thing to do. But if they both ignored it, at least the attending physician could have circled back later in the break room or the staff room and said to the resident, "Hey, I saw that happen, and I was sort of, confused in the moment about what to do, and then the moment passed, and what was that like for you? And is there anything you want to talk about?" And at least acknowledging, "Hey, I saw that," can be a really powerful thing to do.
Yeah, I agree. I think that just acknowledging the situation provides validation for the person that was being mistreated, and they can feel maybe more comfortable later on to be able to speak to their attending or somebody on the team about the situation.
Yeah, exactly. Destiny, I think we have one more scenario. Is that right?
Yep, we do. So our last scenario is a Korean American nurse is taking care of a patient in a nursing home and tries to help him out of bed. The patient yells, "Get out of my room. I don't want any Chinese-looking nurses touching me. I only want American nurses who speak English."
So this scenario obviously goes well beyond the realm of microaggression into just overt mistreatment. And this actually happened in March of 2020, just as the current COVID-19 pandemic was developing. So it kind of happened within that context. But unfortunately, these sorts of scenarios are not uncommon, even outside of the timeline of the pandemic. Destiny, what are your thoughts about this one?
Well, first I wanted to share a couple more details about this particular case. This really happened to somebody that I know personally. And in this case, somebody else stepped in and spoke up for the nurse. So in this case, another nurse stepped in and asked the patient why he was speaking to his nurse in this way. And that nurse also expressed that the Korean American nurse was here to take care of him. And besides, she was American and spoke English too.
Right. So in that way, that person's trying to be supportive, right? Which is good, stepping right in there. Again, kind of pointing out, though, in a way, implying at least, hey, it's not really a big deal. You know, she is American and she does speak English. So in a way, that is trying to allay the patient's concerns, but it does, in some sense, validate them, right? Because the implication is, if she wasn't, if she wasn't born here, or if she did have language differences, that would be a big problem. I think in discussing this scenario previously in preparation for this, I think you mentioned that there was a male physical therapist who stepped in. Is that right?
Yep, that is right. Thanks for reminding me.
Yeah, sure.
Later on in the same day, the Korean American nurse attempted to serve the patient his meal, and the patient then yelled that they didn't want the nurse even touching his food. At that point, a male physical therapist observed and stepped in, and he stepped in and told the patient that it didn't matter what the nurse looked like or where she was from, that she was trying to take care of him, and that he was going to treat all of the staff members at the nursing home with respect.
Right. Again, being supportive and being directive can be really good. As you and I have discussed previously, we need to be careful about tone there, right? We can't have providers, berating patients, but there can be, sort of that, as we talked about earlier, kind of that firm but gentle reminder, like, hey, we need to be on the same team here, and that means being respectful. And we are going to do our best to be respectful of you, and we respect the same in return. Right? So one of the questions is how to respond effectively to mistreatment. One of the things we want people to do is to take action and speak up when possible. Now, one of the first things we advise people is to try to avoid humor in these situations. There have been some talks we've given where we've talked about the potential use of humor to try to defuse certain situations, but too often that can really kind of go off the rails and have unintended consequences where there's some nervous laughter, and sometimes it can kind of fuel the misbehavior of the perpetrator rather than end up being supportive. So one of the things that we often suggest is if somebody says something offensive, for example, asking that person what they meant. Like literally, just neutrally saying, what do you mean by that? And oftentimes when they have to kind of repeat or explain the words that they've said, it's obvious to them and to those around them that this is not okay. And that can be an effective way to intervene. It's completely fine to say or indicate that you're uncomfortable. Sometimes that might be with some subtle body language or facial expression. Sometimes you might even say, I'm not comfortable with this. It's okay to say that. It may feel weird to think about saying that, but if you actually say that in a situation, it may end up feeling more natural than you expect. One of the things that we really try to do is encourage people to avoid personal attacks. Sometimes when someone says something or they mistreat a friend, a colleague, a loved one, it makes us angry and hurt. And sometimes our natural instinct, if we're going to be an upstander, is to really be an upstander and come on pretty strong and start name calling, or, why are you so racist? Or why are you such a misogynist? And you may be thinking those things, it's completely natural. But when people resort to that sort of intervention, usually the teachable moment is lost. It can often kind of inflame and escalate the situation. Sometimes it will make the perpetrator engage in even worse behavior. So avoiding personal attacks is good. And whenever you can, do try to make it a teachable moment. A lot of times when someone commits a microaggression, just by the very nature of that concept, they didn't mean to. Oftentimes they'd feel bad about it, and using that as a teachable moment can be really powerful. And you can think of it as, instead of calling them out on something, calling them in. And sometimes you might use wording like, hey, you know, I've known you a while, and you don't seem to be the kind of person that really goes around like wanting to hurt people's feelings. So I just need to let you know that what you just said really can be really hurtful and considered offensive to a lot of people. You know, and so that way you're kind of using it as a teachable moment. Or and calling out the action is important. Again, rather than directly insulting the person, you might say something like, you know, the way that you spoke to that nurse regarding her race was disrespectful, and we don't tolerate that here at UIHC. And the last thing I want to point out here, before hearing your additional comments on this, Destiny, is it can't always be left up to the person being mistreated to be responsible for, you know, for educating the person who's being offensive. Okay, there's a lot of fatigue involved there. The person who, at the very moment they're feeling hurt, they're being expected to speak up and educate this person. That's really when support is needed the most. So we'd really encourage people not just to stand back and think, oh, they'll handle it. It's really all of our responsibility to try to make this a welcoming and inclusive place.
Those are some really great points. I did want to add to your point about asking the person what they meant. In addition to kind of allowing them to repeat and maybe seeing their mistake, in some cases, I've been pleasantly surprised because the person might not even realize that the way that they said something could come off offensively at all. And so, like you said, that can make it into a teachable moment. So, you know, obviously overtly offensive behavior is not tolerated, and I'm not trying to make excuses for those sorts of things at all, but sometimes people just really don't know. So moving on to a few more points that we had about how to respond effectively, we just wanted to talk about some ways that you can support the person that was mistreated. So first of all, being able to say something. We hope that by watching this video today that you'll be able to feel empowered and learn some new tools in order to speak up against mistreatment. The second thing is validating. So showing the person who was mistreated that you saw what happened and that you are there if they need anything can be a really powerful and supportive action. Finally, ask. So ask the person if they want you to say anything or if they need anything from you or what they would like you to say or do. Really try to focus on the feelings of the person who was mistreated rather than on your own. I think you had some more words to kind of say about this, right?
You know, it's not uncommon, I think, for any of us, if we find that we've offended someone, to apologize. It's absolutely the right thing to do. Apologize, but then apologize and try to move on. I know I have found myself in situations where I've offended someone and I apologized a little overly profusely, sort of thinking, I'm going to show them how sorry I am and I'm going to apologize for 5 minutes, you know. And really what inadvertently happens in that scenario is then it almost becomes the person who was offended in the first place. It becomes like their responsibility to make me feel better about the situation, and it becomes about me, right? And so even though you might feel like the right thing to do is apologize super profusely, it's often way more effective to say, wow, I am so sorry that I hurt your feelings. I didn't mean to. And then, unless that person wants to engage in a continued discussion, just move along.
Those are some really great points. Thanks for bringing those up. I just had a few more things I wanted to add. So the first thing, like you said, was to say something. So hopefully after watching today's video, you feel empowered to speak up when you see mistreatment happening. The next thing is to validate the person that was being mistreated. So either telling them like, hey, I saw that happen to you. Do you want to talk about it? Or offering them more formal support if they decide that they want to report the mistreatment in any way. Finally, ask. So there can be many ways that you can ask. First, you can ask how they're feeling. You can ask them if they want to speak up for themselves or if they want you to say anything. Allow the person to step out of the situation if they are feeling uncomfortable. Ask how you can help. And then finally, try to focus on the feelings of the person who is being mistreated rather than on your own. Thanks so much for listening. We hope that you feel empowered to stand up against mistreatment the next time that you see it. We've created a handout that should be attached to this video that you can hopefully refer to for future use.
We in the Office of Diversity, Equity, and Inclusion are here for you. We would love to hear from you if you have suggestions on how to make UIHC a more welcoming and inclusive place, or if you have any problems or concerns about yourself or friends, colleagues, definitely give us a call, because we'd love to help you navigate any difficulties that you're having. And lastly, we definitely want to acknowledge the contributions of the others who helped produce this presentation as well. The Office of Diversity, Equity, and Inclusion is led by Associate Dean Dr. Denise Martinez, and Dr. Martinez and our whole group look forward to working with you. Thanks for your attention today. Be well.